Good morning. Thank you for attending another edition of our IHCP Live webinar series. My name is Michael Cook. Today's topic will be focused on policy updates and reminders around Applied Behavior Analysis, or ABA services. We've got three primary objectives on today's agenda. We will be speaking first on some specific provider enrollment changes for our ABA provider community. We will then be spending some time on some treatment plan and documentation reminders, and then we'll round out our presentation on prior authorization reminders with some helpful tips and tricks at the end. We'd like to start today's presentation on the most important policy update, which is specific to provider enrollment changes that will be occurring over the coming weeks. Effective December 18th of 2024, existing ABA therapy enrollments will be renamed and reclassified. So today we enroll provider type 11 behavioral health with specialty 615 for ABA therapists. That will actually be transformed into ABA therapists for master's, doctoral, or IHCP. We're going to be making some other key changes with this name change. All group and billing enrollments with this specific specialty will be reclassified to high risk. All group and enrollment and billing enrollments will be retroactively also subject to an IHCP site visit. In addition, all group, billing, and rendering enrollments with this specialty will be retroactively subject to a fingerprint-based background check. Now again, for high-risk groups and billing enrollments, that means a fingerprint background check for all owners or individuals with 5% or more ownership interest in the organization will be subject to the background check. A site visit will be performed by a Gainwell representative, and the standard screening and disclosure requirements will be applied. All IHCP groups with actively enrolled ABA therapists, which again is those individuals with specialty 615, will be receiving a formal notification. If you see the example on the left side of your screen, this formal notification will advise all those individuals, all those group enrollments of this new requirement to get a fingerprint-based background check completed. We are requiring providers to come into compliance by July 1st of 2025. So over the next 6 months, all rendering practitioners, as well as all owners or those with 5% or more ownership interest in each one of the groups that's enrolled as a specialty 615 will be required to come into compliance and submit a fingerprint background check. Some key details on this fingerprint background check requirement include that these checks must be performed through identigo.com. We've got an entire process that's outlined on the Indiana Medicaid provider website with specific instructions for providers to go to identigo.com. And most importantly, when establishing this fingerprint background check, make sure to select service code 24Y791. That's specifically for FSSA Affordable Care Act. That ensures that the background check results will come to our office and will be processed appropriately. Once a fingerprint has been submitted, no further action is necessary by the provider unless you're contacted by FSSA. So again, we just need you to follow the instructions going through Identigo, making sure if you're a rendering practitioner and you have a specialty 615, make sure you get this fingerprint submitted to our office. And again, if you're in ownership with any of the groups or billing providers that are enrolled with this specialty, make sure you take this action as well. But again, once the fingerprint has been submitted, no further action is necessary. The other component of this risk elevation is a required site visit. A representative from Gainwell Technologies will be contacting all enrolled groups that are affected by this change regarding scheduling a site visit. Again, once the site visit has been scheduled and been completed, no further action is necessary for providers. But this is part of the compliance activity that we will have providers complete by July 1st of next year. We want to talk about a couple additional changes that we're making around ABA therapy for provider enrollment. We will now be requiring all levels of ABA therapists to enroll with the IHCP. So we have created new specialties for ABA therapists who are at the bachelor's level, as well as ABA therapists who are at the RBT credential. So individuals with a BCBA or a BCBA-D will continue to enroll as a specialty 615, like they have been today. Individuals with a BCABA credential will select specialty 624. That's for our bachelor's level individuals. And then any individuals with an RBT credential will use specialty 625. All of these ABA therapists' enrollments will be considered high risk upon initial enrollment. So again, even as rendering practitioners for our bachelor's level and our RBT levels, those will be considered high risk and will be subject to the fingerprint background check requirements that we previously talked about. This just provides a quick high-level summary of all the information about the enrollment changes. So again, to reiterate, our current ABA therapy specialty is being renamed to ABA Therapist Master's Doctoral or HSPP. The risk classification affecting both groups, billing providers, as well as rendering practitioners has been raised to a high risk at the initial enrollment. That will drop down to moderate during revalidation for groups and billing. And again, for groups and billing enrollments, we will be looking for, not for groups, but for either billing or rendering enrollments, we will be looking for an active HSPP licensure, a copy of your BCBA-D certification, or your BCBA certification. If you're at the ABA Therapist Bachelor's level or the ABA Therapist RBT level, those enrollments will be rendering only. They will be considered high risk, and we will be looking for a copy of either your BCABA certification or your RBT certification. As a reminder, rendering providers do not revalidate, but they will be subject to the fingerprint background check prior to enrollment. We have made this a requirement, and starting for dates of services on or after April 1st of 2025, the rendering practitioner on a claim must match the procedure code modifier indicating the level of the ABA provider rendering the service. This is really important, but again, over the next several months, making sure that all of your RBTs, all of your BCBADs, all of your BCABA practitioners are all enrolled and recognized by the IHCP. If you do not have these individual practitioners enrolled by April 1st, you will begin to see claims payment disruption. When we talk about this requirement about making sure that the provider matches the modifier, our current billing guidance requires that providers use a modifier to indicate the level of practitioner that's rendering the service today, whether that's a U1 modifier for RBTs, a U2 modifier for those at the bachelor's level, and then a U3 at the master's, doctoral, or those who are HSPPs. Our claim system will now be configured to be looking for matching up the modifier that's used on that particular claim detail, looking for the appropriate rendering practitioner to match that level of ABA practitioner. So again, if you have a claim detail where you are billing with an appropriate procedure code, the U2 modifier, our claim system would be looking for an enrolled specialty 624 rendering practitioner. Now we're going to switch gears and go through some treatment plan and documentation reminders specific to ABA services. Just providing an overall definition between the two overall categories of ABA services. We group ABA into comprehensive services as well as focused services. Comprehensive services treat multiple ASD symptoms, and these can include deficits in language, cognitive, social, and play development, with the goal of not only improving behaviors, but also reducing the severity of the disability in the long term. These are considered all-encompassing services treating multiple symptoms, and it's really meant for the early stages of an individual's development. On the flip side, focus services are focused more for individuals later in development with specific behaviors and skills to be targeted. These may include sleep challenges, play and social skills, tantrums, individuals with aggression. They are directly to the individual for a limited number of behavioral targets. As a reminder, individuals may be eligible for ABA services if they are enrolled with the Indiana Health Coverage programs. Those individuals must have a diagnosis of autism spectrum disorder by a qualified healthcare provider, and they must have a completed diagnostic evaluation. Those individuals who are considered qualified healthcare providers include doctoral level licensed clinical psychologists, licensed physicians with the appropriate training in the current diagnostic guidelines for ABA, as well as other behavioral health specialists with training and experience in the diagnosis and treatment of ASD. ABA therapy may be covered for individuals from the time of initial diagnosis through the age of 20. An individual's initial ABA therapy may be approved for up to 6 months with prior authorization. And with those prior authorization requests, we are looking for a comprehensive diagnostic evaluation, a physician's referral, a behavior assessment, and a treatment plan. And we're going to spend just a few minutes reminding folks of what we are looking for each one of these components. Starting with the comprehensive diagnostic evaluation, the diagnosis may be provided by, again, a doctoral level licensed clinical psychologist, licensed physician, or other licensed healthcare professionals with the appropriate training in the current diagnostic guidelines. When we're looking at that comprehensive diagnostic evaluation, or CDE, we're looking at several specific evaluation components. We're looking at the medical, social, family, developmental, and autism-focused interview with a caregiver, structured observation of the individual's current social communication skills, review of available external evaluations or screenings, as well as clinical documentation of the completed autism diagnosis. Additional components include the documentation that the individual's behavior adversely affects development or communication, or demonstrates injurious behavior and cannot adequately participate in home, school, or community events. We're also looking for a referral for autism-specific supports and services. The next component is the behavior assessment, and this is to be used to identify behavioral deficits that interfere with a major life activity. The IHCP requires that a behavior assessment includes 3 standard behavior instruments. Those include the Vineland Comprehensive Parent Interview, and again, this must be completed with a parent or a guardian. We're also looking for the Behavior Assessment System for Children Parenting Relationship Questionnaire. And we're also looking for an objective direct skills assessment as age appropriate. All 3 of those are standardized required behavior instruments. Providers are free to use additional behavior instruments as necessary. We've identified several examples, including updated skills assessments, functional behavior analysis and/or preference assessment, as well as an assessment of basic language and learning skills. When you're submitting your prior authorization requests, we do look for a complete scoring report, including outcome measure scores and graphs to be included with that request, really to be as comprehensive as possible. This behavior assessment should be reassessed every 6 months, with more frequent assessments being conducted when new behaviors emerge or when additional ABA services are medically necessary and likely to address emergent behavior. Finally, when addressing the treatment plan, each individual must have an individualized treatment plan. It needs to be based on the individual's needs, age, school attendance, and other daily activities, excluding any non-covered services, obviously. Over the next couple of slides, we're going to reiterate the specific components of the treatment plan that we're looking for. Those specific components include identification of an individual's behavioral, psychological, family, and medical concerns. We're going to be looking for short-term, intermediate, and long-term goals that are age-appropriate based on standardized assessments, addressing behaviors and impairments for which the intervention is to be applied, and individual baseline baseline measurements of social, communication, language, adaptive functioning skills, repetitive and self-injurious behavior. We're going to be looking for the number of hours per week requested with justification. We'll be considering the individual's age, their school attendance, other activities. We'll also be looking for the developmental level of individuals' needs for rest, nutritional breaks, as well as interaction with peers. We will be looking for parent and guardian training goals, as well as a clear schedule of services that are planned. Additional components include that the interventions are consistent with evidence-based ABA techniques. We're looking for a plan for generalization and maintenance of that individual, as well as a plan for titration and discharge with attainable or measurable goals. The treatment plan must address any comorbid medical, psychiatric, substance use disorders affected by the individual. They must engage family caregivers and other individuals impacted, and they must include explicit and measurable recovery goals. For some additional key documentation reminders, providers must be able to produce any documentation requested within 72 hours of request, and that includes the physician's referral or the CDE we talked about, the behavior assessment, the treatment plan that's signed by the lead analyst and the parent or guardian, and any therapy session notes that are identified. Those session notes must include the date, the time, the location, and the duration of the services, as well as any session-specific targeted skills and individual responses addressing the treatment plan goals. Now we're just going to briefly talk a little bit about prior authorization. We talked mostly about the documentation requirements. We'll just talk a little bit about the process. We'll break this out between the initial authorization period and continued authorization. Again, for the initial authorization period, ABA services can be approved for up to 6 months. And we're looking for that comprehensive diagnostic evaluation, the referral for ABA services, the behavior assessment, as well as the components within the treatment plan. Once we get past that initial 6-month period or the initial approved authorization period, for any continued authorization, we're going to be looking for documentation that symptoms still meet the criteria for autism, that there's a reasonable expectation that the individual will benefit from continuation of ABA therapy. We will be looking for an updated behavioral assessment, as we talked about previously, and we'll be looking for clinical updates to the treatment plan, and in particular looking for progress in the individual's social, communication, language, and adaptive functioning, as well as their overall behavior. We continue to reiterate that we are looking for specific data and measurable goals to be met. So we want data to be included on any continued authorization requests, Those should be measured using the same method and tools throughout the individual's episode of care, and they should be compared against baselines established at the initiation of care, and also compared to benchmarks of normally developing peers. If significant clinical progress is not made, we're looking for an explanation of the lack of clinical progress for that individual, as well as any modifications to the treatment interventions to promote that individual's progress. And we like to conclude these presentations by just reminding providers of some key resources that are available as IHCP providers. We offer regional field consultants that are located throughout the state of Indiana who can help with claims issues and enrollment concerns, and generally understanding the ins and outs of the IHCP. We publish our provider reference materials, all of our written materials that outline the policies of the IHCP, and in particular to ABA services. All of our details are outlined in our behavioral health services provider reference module. And we continue to host ongoing webinar opportunities like today's IHCP webinar presentation. If you'd like to stay updated on everything that's happening within the IHCP, best place to go is to go onto the IHCP provider website. Scroll down to the bottom of your screen, you'll see a little green box. It'll ask for your email address. Once you sign up, you'll be notified on a weekly basis of any bulletins, module updates, and web page updates that we make to the IHCP. We do encourage providers to contact their provider relations field representatives first. We'll have a screenshot of that available in the next slide. But if you've worked with your provider relations field representative and not quite getting the answer that you're not enough details to the answer, you need a little bit more details, you can contact the OMPP provider relations team at ompproviderrelations@fssa.in.gov. We also house a separate inbox for feedback on our presentations that we do, ideas for future presentations, or if you just have a question that could be addressed in a future publication, you can send those to ihcplistens@fssa.in.gov. Again, we do encourage providers to reach out to their provider relations field consultant as their first line of defense for questions. You can find this information, again, listed on the IHCP provider website with the most updated email and phone number information. We do want to make sure that providers are referred to IHCP Bulletin BT 2024194, was published last week, provides all the details that we discussed in today's webinar. If you do have specific questions about the bulletin or anything that's been presented in today's webinar, you can reach out to OMPP Provider Relations at fssa.in.gov. We do want to thank everybody for attending today's presentation of IHCP Live. A recording of today's presentation will be posted on the IHCP Live webpage. So this will be posted likely within the next week. We do have an additional webinar that will be available on December 18th. Registration is available now. If we do receive some questions in our inbox or in the chat, we may include those questions and address some additional details in the next webinar. So we do encourage you to check out that registration if you're interested. Again, thank you all for attending, and we hope you all have a good rest of your day.